Hello everyone, and welcome back to another insightful episode of Medical Physics 101, a video series brought to you by Physical Sciences Consultorium in collaboration with Science for Everyone. I'm your host, Sujit Singh, and today we're diving into a fascinating topic, the role of physics in treating respiratory diseases. Respiratory health is essential to human survival, and with advancements in medical physics, we now have innovative technologies that support lung function and treat diseases affecting the respiratory system. In today's episode, we explore how physics plays a crucial role in these life-saving technologies, from ventilators to cutting-edge treatments like ECMO. So, let's get started. To understand the role of physics in respiratory treatment, let's first take a quick look at how the lungs function. Our lungs are responsible for exchanging oxygen and carbon dioxide, a process driven by basic physical principles like air pressure and diffusion. When you inhale, the diaphragm contracts, expanding the chest cavity and reducing air pressure inside the lungs, allowing air to flow in. When you exhale, the diaphragm relaxes, and air is pushed out as pressure increases. This exchange of gases happens through diffusion, where oxygen moves from the air sacs in the lungs into the blood, and carbon dioxide moves from the blood into the lungs. This process is governed by the difference in gas concentration and pressure gradients, both of which are rooted in physics. Now, let's talk about ventilators, crucial devices for patients who cannot breathe on their own. A ventilator works by applying positive pressure to push air into the lungs, mimicking the natural process of breathing. Physics plays a key role in how ventilators function. The machine controls air pressure and volume to ensure the right amount of oxygen is delivered to the patient. There are two main types of ventilators, pressure-controlled and volume-controlled. In pressure-controlled ventilation, the ventilator regulates the pressure applied to the lungs, while in volume-controlled ventilation, the machine ensures a specific volume of air is delivered during each breath. The physics here involves understanding air resistance, flow rates, and lung compliance, how easily the lungs can expand. Modern ventilators are finely tuned to match a patient's needs, ensuring optimal gas exchange. For less invasive forms of respiratory support, we have devices like CPAP and BiPAP machines. These machines are commonly used for conditions like sleep apnea and chronic obstructive pulmonary disease, or COPD. A CPAP, or continuous positive airway pressure machine, works by delivering a steady stream of pressurized air through a mask. This air pressure prevents the collapse of airways during sleep, ensuring the patient continues breathing. A BiPAP, or bilevel positive airway pressure machine, alternates between higher and lower pressure levels to make breathing easier for patients with more severe conditions. The key physics concept here is pressure differential, maintaining a positive pressure that keeps airways open. It's a simple application of pressure, but it can be life-changing for people with respiratory issues. Oxygen therapy is another critical treatment for patients with respiratory diseases, especially those with low blood oxygen levels. Whether delivered through a nasal cannula or a mask, the goal is to provide high concentrations of oxygen to aid in breathing. From a physics standpoint, this involves controlling the flow rate of oxygen and ensuring that the correct oxygen concentration reaches the patient's lungs. Oxygen diffuses into the blood based on partial pressure, following the same principles of gas exchange we discussed earlier. High-flow oxygen systems can deliver oxygen at rates of up to 60 liters per minute, helping patients in critical condition. When it comes to severe cases of respiratory failure, ECMO, or extracorporeal membrane oxygenation, can be a life-saving option. ECMO essentially takes over the function of the lungs and heart, oxygenating the blood outside the body. The physics of ECMO involves controlling the flow of blood through an artificial lung, where oxygen is added, and carbon dioxide is removed. This process relies on precise gas exchange through a semi-permeable membrane, again, a function of pressure and diffusion. ECMO is often used as a last resort for patients whose lungs are not responding to other treatments. Physics isn't just important in treatment, it's also essential in diagnosing lung diseases. Imaging technologies like X-rays, CT scans, and ultrasound use the principles of wave propagation and energy absorption to create detailed images of the lungs. For example, in X-ray imaging, high-energy waves pass through the body and are absorbed by different tissues to varying degrees. This creates a contrast that allows doctors to identify issues like pneumonia or lung cancer. Similarly, kinetic scans combine multiple X-rays to form a 3D image of the lungs, providing even more detail for diagnosis. As we look to the future, exciting advancements are being made in the field of artificial lungs and other innovative lung treatments. Scientists are exploring ways to bioengineer lungs that can be used for transplants, and physics is at the core of this research, whether it's understanding how to mimic lung tissue, or improving gas exchange mechanisms. The future of respiratory care looks bright, and with continued research and collaboration, we may soon see even more breakthroughs in this field. That brings us to the end of today's episode. We've covered the role of physics in everything from ventilators and oxygen therapy to advanced treatments like ECMO and emerging technologies like artificial lungs. As always, this series is brought to you by Physical Sciences Consultorium and Science for Everyone. If you found this episode informative, don't forget to like, comment, share, and subscribe to our channel. We encourage you to collaborate with us or sponsor future episodes if you share our passion for making science accessible to all. Thank you for watching, and stay tuned for more exciting episodes in our Medical Physics 101 series.